Officer for Australia, Professor Alison McMillan, and we're here to announce the next step in preparation for Australia's COVID-19 vaccine rollout. In particular, as of today, COVID training modules for vaccinators will be made available. This is an electronic learning or e-learning process available online. It follows the process which we've taken with infection control. I should say it's an extraordinary result to date with infection control. Over 1.4 million Australians have undertaken infection control training courses online, and that includes over 3.6 million modules which have been uploaded and which have been completed. So Australians have really stepped up to the task of keeping other Australians safe, and I want to say thank you and to offer our profound appreciation. The next step is preparation for the vaccines. And these modules, which have been developed in conjunction with the Australian College of Nursing and an expert panel, which they have helped oversee and led in particular by Alison McMillan as Chief Nursing and Midwifery Officer, have been created so as all vaccinators must be fully qualified in order to carry out the vaccinations. It's not difficult, but it's an important step, and that includes content which is relevant to the vaccines that Australia will be using, in particular the use of what are called multi-dose vials. So instead of a single shot from one vial, what we'll see is that there will be multiple doses, 6 in the case of Pfizer, 10 in the case of AstraZeneca on provisional advice subject to TGA approval. Handling and storage, safety and surveillance, all of the elements which will be critical to ensuring that vaccination occurs in a safe and effective way. It's available either from health.gov.au or from www.covid19vaccinationtraining, all one word, .covid19, that's numeric 19, vaccinationtraining.org.au. And they are the next step in our vaccine rollout. In relation to cases, the advice that I have from the National Incident Centre is that there have been 2 cases of community transmission in the last 24 hours reported. That's obviously one in New South Wales of a person who has left hotel quarantine but tested positive on the 16th day. I think it's a very important sign that the new procedures which have been put in place did detect this case, and there'll be a bell curve. There'll be a range of times and impacts in a world of 106 million cases which will show. And what this has done is detected a case, and New South Wales is investigating the circumstances of the case, and now they're following up with extensive, immediate, comprehensive contact tracing. But it's a very important sign that even with a case in a very unusual circumstance, that was able to be detected. Similarly with Victoria, a hotel quarantine worker, Victoria's outlining the circumstances, but their testing has found that worker early and allowed for the immediate process of contact tracing. So both systems worked in the detection and both are working in the tracing, the identification of contacts, the isolation. And this is part of what Australia will face going forwards, as we always said. We've now had 17 out of 20 days of 0 cases. Today is one of the 3 days that hasn't been. But we've been tested over the course of the summer. South Australia, Victoria, New South Wales, Queensland, Western Australia, and all of those mainland states which have had those tests have successfully managed the outbreaks and contained them. And our belief, and the advice I had from Professor Murphy shortly before joining you, is that the states have responded quickly and comprehensively, and we have no reason to believe that the pattern of control which has been in place through the summer will break in any way. In other words, we have full confidence in both states and their responses. Globally, of course, now, as I mentioned, 106 million cases, 2.3 million lives lost. And our comparison, just in speaking with colleagues from overseas in recent days in the United States and in the United Kingdom, they look at Australia and they frankly are astonished at the achievement and envious of the position. And we are very humble in what we put to other countries, knowing that we're both fortunate and prepared, but others look at what's occurring in Australia and frankly they just wish they were in our position. Our testing regime, 13.3 million cases in Australia, and our telehealth regime has seen over 47 million telehealth consultations occurring, an extraordinary revolution brought about by COVID, but a profound change, arguably the largest change in the delivery of Medicare services since Medicare was created, done by Australians for Australians. 0 lives lost, and importantly, 0 Australians on ventilation or in ICU due to COVID-19. Just with regards to the vaccine rollout, I've also spoken either today or on the weekend with the heads of Pfizer and AstraZeneca for Australia, and both have confirmed that we remain on track for our guidance of late February commencement for Pfizer, early March commencement for AstraZeneca, subject to the TGA assessment and approvals. And I would on that add a small point in relation to some of the variants of concern. So these are the fact that the virus does mutate. There are variants. There have been a very high number reported globally. The South African and the UK are the best known of those, and the advice I received both from the Chief Medical Officer in writing and in discussion with the head of the Vaccines Task Force, Professor Brendan Murphy, this morning is preliminary, but there is currently no evidence to indicate a reduction in the effectiveness of the AstraZeneca or Pfizer vaccines in preventing severe disease or death. The world, however, is reviewing data with regards to the impact on transmission of mild to moderate symptoms, and we'll be looking at the latest data coming out of trials and tests and research programs around the world, and we will see during the course of this pandemic, not just every week, not just every day, but sometimes multiple times a day, different pieces of news. Some of them heartening, some of them challenging, but the broad direction is positive. The vaccination programs around the world are making a difference. The vaccination program in Australia continues to be on track, and I think that's heartening, important news, but we will follow the evidence, we will follow the advice of our Therapeutic Goods Administration and our Scientific and Industry Technical Advisory Group and our Australian Technical Advisory Group on Immunisation, the 3 medical expert panels which oversee vaccination and oversee vaccine approvals in Australia, but we continue to be in a strong position. Alison?
Thank you, Minister. So, as you've heard, we've launched the training this morning. The training is focused on staff who will be administering the vaccine. As a health professional, we live a life of learning. We continuously have to update ourselves on whatever information is important to protecting all Australians. So the training is online. It's a set of module learning set that people can process through over time, and it will produce a certificate at the end. The training is quite broad because it needs to meet the needs of quite a broad range of health professionals, and it will, as I say, particularly focus, as the Minister has said, on those areas we know for some will be new, particularly multi-dose vials, which need some special techniques in order to assure patient safety, and learning and understanding about the management and handling of the new vaccines, how to manage any adverse events, and how to record all of this information so it can be uploaded and provided to the public. So we're pleased to say that this training is now available. Obviously, our focus in the first component of this will be health professionals working in the Pfizer hubs and those delivering the vaccine on an in-reach programme to aged care. So first step, the training will continue to be updated as potentially more vaccines may be approved through the TGA, and that will remain contemporary information for all health professions. Thank you, Minister.
Great. Thanks very much. So I'll take a question from in the room, Priyanka first, and then come to those that are on the telephone.
Yes, thank you, Minister. So starting with, we're hearing that news out of South Africa that they've decided to halt the AstraZeneca vaccine because of concerns that it's ineffective against the strain there. Should that be a concern for Australia and Australians, considering it's such a key part, the AstraZeneca vaccine, in terms of the vaccination rate?
Look, on the one hand, we have outstanding results coming out of the UK. I spoke with the UK Health Secretary, Matt Hancock, that's the equivalent of the Health Minister for the United Kingdom, only a few days ago, and they're very, very pleased with strong evidence which has been presented by Oxford University about the Oxford AstraZeneca vaccine. There are particular studies which are being done in South Africa, so we'll continue to follow that. But the advice as of this morning from the Chief Medical Officer of Australia, Professor Paul Kelly, and the head of the Vaccines Task Force, Professor Brendan Murphy, is very, very clear, and that is there's currently no evidence to indicate a reduction in the effectiveness of either the AstraZeneca or Pfizer vaccines in preventing severe disease and death. And of course, that's the fundamental task, to protect the health of not just Australians, but people all around the world. At the same time, where there is new evidence being presented with regards to either the transmission or mild to moderate, that's important for everybody. But we put our faith in the TGA, and the TGA will operate as a free, fearless, independent agency, and they'll continue to provide the advice, and they'll be providing further advice shortly. But I'm giving you the update as given to us only shortly before coming to you by both the Chief Medical Officer and Professor Murphy. Tamsin.
Thanks, Minister. I have two questions, if that's all right. The first was just about hotel quarantine, which has been potentially the quarantine condition needs a bit of a look at, but that may not be entirely fit for purpose now. What are some of the changes that the government is considering, and where can we go to from here?
Okay, Tamsin's question is about hotel quarantine. So the first thing is we've had over 211,000 people come home to Australia through hotel quarantine, and one of the things that the UK was doing in our discussion was looking at what they regard as the global gold standard of quarantine, which is the Australian hotel quarantine system. So I think there are two things here. Firstly, we've always said that hotel quarantine is the inner ring of containment, followed by testing, followed by tracing, followed by distancing. So I think where anybody indicates that there's only one line of defence, that would be inaccurate. And for people to rely solely on that isn't about adequate protection of Australians. We've got multiple layers of protection, multiple rings of containment, borders, testing, tracing and distancing. Related to that, of course, is that wherever we're engaged with the world, Australians coming home for births or to say goodbye to loved ones who are in palliative care, whether we are exchanging our goods and our services, selling our food or our fibre, if we're bringing in critical medicines, then of course we're engaging with the outside world. And so we have said right since the earliest days a year ago that there would be cases and that we have to be able to prepare with the public health responses, as we've seen this summer, magnificent public health responses across the jurisdictions. So then that brings me specifically to hotel quarantine. We're always learning, and what we see now is that we've put in place additional testing, additional requirements with regards to the PPE through the advice of Jane Holton, the distinguished former Secretary of Health and of Finance. We've seen saliva test introductions, and we'll continue to look at actions that can be taken. We're providing additional ADF support, for example, in Victoria, doubling the number of Australian Defence Force personnel that will be available. Victoria requested, I think my advice is, on the 29th of January. Our response was on the 3rd of February. The first 50 of those ADF personnel arrived in Victoria last night, to more than double the number of Australian Defence Force personnel to assist with that hotel quarantine program. So continuous infection learning, continuous upgrade. AUSMAT remains perhaps the international leader, along with a small number of other countries, in providing that infection control. And I think, Alison, you're an AUSMAT leader in this phase. You actually went to Japan, is that correct? So Alison was part of the team that staged the airlift of those that needed to be lifted from Japan and brought back to Australia. James.
Thanks, Minister. I've got two questions relating to the case in New South Wales. Firstly, can you clarify if this new case is being considered as community transmission? Because as early as this morning, the New South Wales Authority considered the case likely acquired the infection overseas before testing positive on day 16. And to that, from your perspective as the Federal Health Minister, was there any specific health advice that has led to New South Wales implementing this day 16 test, testing people 2 days after they leave hotel quarantine on day 14?
Sure. Look, firstly, with regards to the New South Wales case, we'll let New South Wales outline the epidemiology, the likely source, the likely origin. We've included it because it's a case which has been within the community outside of the hotel quarantine system. It's included in the National Incident Centre list and register. Our national approach is to be as comprehensive as possible, and we're following the advice of the National Incident Centre reporting rules on that front. Secondly, with regards to the New South Wales testing regime, they work in conjunction, and they're magnificently led by Kerry Chant, honestly, just an extraordinary leader. They work in conjunction with what's known as the AHPPC, or the Australian Health Protection Principal Committee, which involves all of the Chief Medical Officers. And Damien, Channel 9.
Yeah, on that, was it a masterstroke then by the New South Wales Health Authorities to introduce this day 16 test? And do you think it should be rolled out right across the country?
I think New South Wales has been ahead of the curve. They have carried it out magnificently, and I think they've provided a model for the rest of the country. Natasha.
Hello. It's quite a question in relation to the South African strain. Doesn't it follow that if it doesn't protect against mild to moderate disease in the South African strain, it may not protect against severe disease either? And would this be a reason that Australia might shift to Novavax as a priority, considering it has shown efficacy against the strain?
Look, I think one of the very important things here is that we follow the medical advice. What we're seeing in the United Kingdom is very strong medical evidence, obviously with material being published by Oxford University. There's a real-world experience of some millions of vaccinations that's occurring, and we're seeing very positive results. I'd also note, on the advice that I've received, South Africa has dropped from about 18,000 cases per day on a rolling 7-day average in mid-January to approximately 4,000 cases per day at the moment on a rolling 7-day average. Now, the causes and the reasons, we'll leave that to the South African authorities to outline, but South Africa's made great progress. So then, in terms of how we assess the vaccines, the simple ironclad rule for Australia is that we have 3 medical expert committees, 2 which are advising on vaccine selection or on vaccine rollout. That's the Scientific and Industry Technical Advisory Group, led by Professor Brendan Murphy, and the Australian Technical Advisory Group on Immunisation, which always determines the conditions under which any vaccine is implemented. and the Therapeutic Goods Administration, which is the medical regulator. They determine which medicines and which vaccines are safe and effective for use in Australia on the basis of arguably as rigorous a process as any in the world. And if the TGA gives it the tick, then it's safe and effective, and we'll follow their advice. Ronald, AFR.
The Prime Minister today and on Friday was talking a lot about COVID-19 becoming like any other virus in the community, sort of here but not dangerous. That's why it shifts away from effective suppression or elimination, depending on what the danger is, something else. I'm wondering if you could provide a bit more detail about what that shift looks like, when it could happen, what are the market laws for that shift, and are the states on board with that?
So there are two trends here. Firstly, we are seeing a decrease in global numbers in total daily cases, and I think that's early. It could be reversed, but it is a clear trend now over a course of about 3 weeks. As global numbers continue to come down through a variety of reasons over the course of the next year, whether it's vaccines, whether it's containment measures, whether it's any change in the nature of the virus itself, whether it's the fact that there have been enormous numbers of people, sadly, that have been infected. And then at the same time, as we have an increase in vaccination here in Australia, what that means is that the risk to the community of lives lost, of serious illness, of hospitals being overwhelmed, plummets. Now, we're already managing that risk through a containment strategy that is as good as virtually anywhere in the world. There's a small handful of countries and jurisdictions that are in a comparable position to Australia. But as those two things occur, reduced case numbers abroad, increased vaccinations domestically, the risk begins to plummet as each of those is significantly advanced. And at that point, the way in which the disease is managed can evolve. And that's what was set up with the agreement of National Cabinet on the weekend. On Friday. And the Secretary of the Prime Minister's Department, Phil Gaetjens, will lead that process, but in collaboration with the states and territories, in collaboration with the Health Department and our medical leaders. And so it's about the milestones which will be determined, but they'll be scientifically based. As we can see the risk, and as we can see that risk abating, then we'll be able to take future steps. We want to get to a situation where no one feels that they need to close a domestic border. We want to have a situation where the responses are tailored to the risk, with public health tracing and testing being the primary response. And that's the direction for the country. We want to be able to travel. We've done well, but we can continue to do well, but with less impact on our daily lives.